Hi Jane, my name is Teodor, Moldovan, and today I will talk about early childhood sleep disorders. I did some research on the internet and I came across a very interesting paper from Cleveland Clinic which talks about pediatric sleep disorders. We know that young children do not need as much sleep as infants, and if they have some active play time during the day, babies and young children will sleep better. Children spend a substantial part of their lives asleep. In fact, in infancy and early childhood, the developing brain seems to need more time asleep than it does awake. This underscores the importance of sleep in the overall well-being of a child. Children may suffer from lack of sleep simply by not sleeping an adequate number of hours, and they may lack good quality sleep. The implication of sleep disorders may lead to daytime moodiness, irritability, lack of focus in class, sleepiness in school. Some sleep disorders are serious enough to cause adverse cardiovascular and metabolic effects, as well as failure to thrive. The most common pediatric sleep disorders are bedtime struggles, night awakenings, sleepwalking, sleep terrors, nightmares, insomnia, and bedwetting. My research is ideal to be presented to a friend or a parent because it teaches them about sleep disorders and is from Cleveland Clinic, which is a valid source. I choose this topic because I used to have nightmares when I was a child, and I wanted to know more about sleep disorders. I learned that sleep disorders can be treated in different ways using surgery, for example, obstructive sleep apnea, micronutrient supplementation, bright light, therapy, or medication. This topic is important because it tells us about implication of sleep disorders, tells us about treatments in sleep disorders and the causes of sleep disorders. Who can relate to this topic and why? I think anybody can relate to this topic because almost everybody have sleep problems, but especially parents with infants and young children, because they can see in their children these sleep disorders problems, and with some knowledge they can treat this issue. What should how can you determine if your child has a sleep disorder? If your child has difficulty sleeping, discuss the matter with a pediatrician, and your child may benefit from a referral to a pediatric sleep doctor to further investigate the problem. For example, at Cleveland Clinic, the pediatric sleep specialists will conduct a thorough medical and sleep history, as well as physical examination to identify any medical problems. In some cases, it may be necessary to observe if the child sleeps overnight. In some cases, it may be necessary to observe your child sleep overnight in their sleep laboratory. There, in a comfortable bedroom-like setting that allows the parent to room in, children are able to sleep without much difficulty while a polysomnogram test is conducted. This test records brain activity, eye movements, muscle activity, tissue oxygen, carbon dioxide, oral nasal airflow, and breathing patterns in sleep. What can what should we remember about this topic? We can remember that sleep disorders are a real problem and should be treated in a serious manner. We can also remember that through sleep disorders, even though sleep disorders is a very serious problem and can affect the growth of a child, there are some treatments that can be used to help children with sleep disorders. Thank you very much.